Welcome to the Honest Health Podcast with your host, Jeffrey Burke. Honest Health brings you the brightest minds in the natural products industry, as well as athletes and entertainers. Jeff will keep you entertained and informed while educating on how to be successful on your healthy journeys. Now, here's your host, Jeffrey Burke.
Hello and welcome back to the Honest Health Podcast. My name is Jeffrey Burke, and I'm so glad you're here. This is a platform that brings you the most up-to-date, groundbreaking information from some of the best minds within the natural products industry, as well as many voices outside the industry, all of them with great messages and stories to share. If you like what we're doing, please consider giving us a like, a share, or subscribe. Better yet, do all three. My guest today, Keri Marshall, is going to give you so much awesome information. She is definitely an industry insider, an epidemiologist, a naturopathic physician, and so many other things. I'm very blessed to be able to work with some of these amazing people in our industry because not only are they continually adding more and more to the information that everybody gets to have, but they do it with such extreme passion. And I think you're going to really enjoy the show today. Hey, Keri, how are you?
Hey, Jeff. Thanks for having me.
My pleasure.
Forward to this for a while.
I think it's going to be great. I've been very lucky over the years, after 42 years of radio shows and working with some of the best in the industry. And now it's been kind of fun having them come on to another platform because you got to remember for 42 years, I would talk to a phone and now I actually get to interact, which is kind of fun. And so I can't have bad hair days when I do the podcast. So thank you so much for being here. I was really blessed and very, very proud of you when we were at Expo West on your new position. You might want to tell people about that. We were jumping up and down. We were so happy for you.
Yes. Well, first of all, Jeff and I worked together at Kokora. So let's just put that out there. And so that's actually part of what you were referring to because on behalf of Kokora, I'm a senior medical and scientific consultant there. And Rick Scalzo, the owner and founder of Kokora, had asked me to run for a board of trustees position for APA, which is the American Herbal Products Association. And he asked me to run on behalf of Kokora. And so Jeff was there in the audience. And as part of my little, pep club cheering me on, I had to give a talk in front of some folks that I just have tremendous respect for. And, many people who were my teachers over the years were in the audience. And anyway, I had to give this talk and I was granted the nod and I'm officially on the board now. So thank you, Joe.
We're so happy to have you on there. Today we're really blessed in our industry. I've been around for a long time and I've seen a lot of the growth and I've seen a lot of this metamorphosis that has transpired, in our industry. And it's nice that we're at a place even more so today where information and transparency and education and keeping everything up to date and following the science and things like this are just becoming so much more, not just accepted, but just normal. We're looking for it. And even the public is starting to really gravitate toward companies that are transparent and giving them the good information that they need because it's a confusing world.
Yeah, it sure is. And, that's one of the things that, I've been really proud of. Actually, speaking of Rick Scalzo, when we were both at Gaia Herbs, we launched a platform called Meet Your Herbs, and it was transformational at the time. It was an industry-first traceability platform that helped consumers in the store or online be able to identify their product and the herbs that were in it and where they were grown and when they were harvested and what levels of phytonutrients were at their highest level and how that was tested. And, it was at a time where we were really trying to build consumer confidence and consumer trust. And, there was some sketchy things at the time about the industry and in particular, identifying which plants or maybe plant parts were in products or just making sure the right plant was actually in there. There were some unfortunate exposés in the media. So it was a really important thing at the time, but it really set the bar for quality control in the industry. And, I'm really excited even with Rick's new work at Kokora and his regenerative organic farm in Costa Rica that, he's taken it to an even higher level with quality control and really measuring and making sure the phytonutrients are in there and that they're effective.
What's interesting about Rick, I mean, he's such an amazing mentor and a wonderful friend, and I'm so blessed that I get to work with him every day. And you would think that you would hit a point when you would sit back a little bit on your laurels and say, okay, we're just going to kind of do it the way we've been doing it. Boy, that is so not Rick. And he is always pursuing honesty and integrity and quality and making sure that he's testing the testing of the testing. And sometimes I'm like, but I mean, I give him the most amazing kudos and respect because, people have learned what to expect from him.
Mhm.
And that hasn't changed a bit. It's just continuing to go strong. And I'm so excited to see where we go with this company and the next level, because I think we're groundbreaking, and I think the timing is perfect. Of course, regenerative agriculture in the news now more than ever, and just bringing quality products to the public that they can see and feel and benefit from, and feel comfortable.
Well, and you talked about how the industry has changed, right? For the longest time, organic was king. That was the most important thing. But now regenerative organic is next level organic, and the standards are even higher. And that's why, again, Rick's Farm in Costa Rica is, a gold certified regenerative organic farm. So they're practicing these tools that support the planet and people in the botanicals, so that they're grown at the highest level to be most efficacious. And so he's, again, really helping to set the bar with that. Whereas, 15, 20 years ago, he was trying to set the bar with organic. So he just keeps pushing the bar a little higher for everyone else to chase after him.
What's funny is over the years, after all the radio shows that I did, I never, ever did a show with Rick. I mean, and we were talking about it, and I said, it's just so crazy. I followed him. I silently stalked him for 30 years, but we never really connected on the radio level. And now with the podcast, we've done 4 so far together, and we're doing this deep dive herbal kind of training program where we do one herb at a time, and we do a deep dive into that herb. And then at the end, we talk more about how regeneratively it's different and better and maybe more potent and more viable. And he's trying to put this series together so that anybody anywhere that goes on there that watches this conversation will walk away and say, okay, I have a much better understanding of that herb. So we're going to have about 15 or 16 in the series. So it's going really well. Our next one coming up is going to be Bacopa.
Excellent. Well, he does grow beautiful Bacopa in Costa Rica.
It's amazing. We've done turmeric, we've done ashwagandha, we've done ginger, we've done passion flower. So Bacopa is the next patient on the list.
Yeah, passion flower is definitely my favorite.
Mine too. Yeah, we're friends. We've been friends a long time. I'm so happy that we had such an amazing, healthy, gorgeous, potent crop down there that grows so beautifully. I have not yet been to the farm. I'm looking forward to going. And I was telling my friends, I said, I've got a camera set up with a hat so I could walk all over the farm and just let everybody watch everything live through my eyes as I'm seeing it for the first time. And I think it'll definitely be something to see.
Yeah, the first time I was at the farm was when the passion flower seeds had just come in and they were figuring out how to germinate it, and there were some challenges. And so I was actually there to be able to do some of the scarring on the seeds through the first planting. So when I see now those fields and fields of passion flower, it's like I was there in that, early moment. So I love it. And, it's such an important botanical, especially with what we're going through in the world right now. We could all use a little passion flower to calm our nervous system.
I think we could all use a timeout, a big one. So to touch on the industry, you and I have been around a long time. We've seen a lot of changes. Maybe talk a little bit about maybe your opinion of how we've changed in the eyes of the consumer.
Yeah. Well, you mentioned when you introduced me that I'm an epidemiologist and a naturopathic doctor, and I did epidemiology first. So I started my career more in research sciences and clinical research, and then went on to naturopathic medical school. And so I had completed my master's in epidemiology, and the department had really wanted me to stay and do my PhD. But I had always wanted to be a physician. And so I really kind of held steadfast with that. But in my graduate programs, I was really studying social and preventive medicine as an aspect of epidemiology in the role of nutrition, lifestyle, and the impact of the environment on disease. And I was like, well, who's practicing this stuff? Like, this stuff is really important. This is it. This is the foundation of health. And thankfully, without dating myself, it was the early days where you can Google something. And so I found out that you could become a naturopathic doctor. And I was like, this is so cool. This is the type of doctor I want to be. All this stuff that I've been studying these past few years, like I want to be able to make these changes for people. And so the department did an intervention, and they literally sat me down. They had the head of the department, all my teachers over the years, and they're like, we can't let you go to this school. We don't even know what it is. Like, it's very strange. They're like, you really need to finish your PhD. And I was like, no, this is it. And if anyone knows me, that's exactly what I did. And I went to naturopathic school, and I was like, I'll show you. And so interestingly, in further corporate jobs that I had, where I had some research dollars to inform important nutrition information, I used to work at Pharmavite, the makers of Nature Made and Mega Food and Eucora and Equel. And we were doing some very important nutrition gap public health information. And I actually went back to my department where I went to graduate school and said, hey, let's collaborate and do some nutrition studies. And we did. We've actually published several studies from working with them. So you can imagine they're proud of me that I've come full circle in all of this. But, it was really like, in even my first years as being a naturopathic doctor, nobody knew what I was. Like, functional medicine wasn't really a word. Integrative medicine wasn't a word. We were still calling it alternative medicine, which, for me, it was never an alternative. It was like, you have a primary care doctor, and I'm kind of your primary care functional medicine doctor that's going to help you integrate it, because a lot of people have a lot of physicians and none of them are talking to each other, and they've labs from all of them, prescriptions from all of them, so it was true integration for me when I had a primary care clinic for 10 years, and I loved it. And I did industry on the side for that period. And then I actually flipped and moved to Washington, D.C. and started doing industry full time. That's actually when I started working with Rick full time as his medical director at Gaia Herbs. And, that I would really say was right around that time, like I mentioned, the Meet Your Herbs program, where there was a lot more attention to supplements specifically. And even that is actually when functional medicine started becoming more popular. And now suddenly medical doctors and osteopathic doctors and nurse practitioners were also starting to talk about nutrition. Actually, Pharmavite, Nature Made, that's some of the early work they did going back 25 years. They started working with family practitioners, trying to get them to understand the importance of things like vitamin D and vitamin B12 and fish oil. Just some of the real basics. And even pharmacists, they were a tremendous effort in helping to educate some of these, primary touch points for consumers, especially in the pharmacies. I mean, these folks are going in to pick up prescriptions and they're, overwhelmed in the supplement aisle. They need to be able to ask their pharmacist, is this going to interact with something? So, some of the work I've done with the companies over the years is really helping to provide guides for these pharmacists to understand drug nutrient and drug herb interaction. Because, hey, guess what? As naturopathic doctors, we were the only formally trained doctors in drug herb and drug nutrient interaction. So again, that's come full circle, and how I can help train other practitioners to understand this too, so that at the end, consumers are safe, because we want them to have safe access to these products.
It's interesting. If I think back to where I began, there was definitely such a communication error between anything medical and anything we were doing, and of course, health food stores.
Mm-hmm.
They were not recognized. It was like a spoken and unspoken battle between them. And
Right.
it's so funny. Today, I was actually at a store yesterday, and I just got back. I was on the road. And I was in a store when a lady came in, and she had a handwritten, and I love seeing this, a prescription pad from her doctor. And on there it says omega-3, vitamin D, magnesium, and a plant-based multiple vitamin. And I said, can I see that? She showed it to me, and I said, what kind of doctor is this? She goes, it's my cardiologist.
Huh?
And I said, really? And she goes, go figure.
Yeah.
And I loved it. It was nice to see. Oh, and COQ10 was on there because he had her on a statin.
Yeah, we actually did a really neat survey when I was working with Nature Made brand, of all the different types of practitioners, again, from even naturopathic doctors and chiropractors all the way to cardiologists, orthopedics. and understanding what were the top supplements, if any, that they prescribed, but also taking themselves. Because it's really telling too that, certain professions like cardiology, they're going to be a little bit more aware of the omega-3s and the CoQ10s. Whereas, a family practice doctor might be a little more familiar with the B12 and iron and vitamin D, because those are things they're measuring in their general practice. So it's interesting by type of practitioner who kind of has a better awareness of what. But at the same point, that whole tide has really shifted amongst practitioners in general, just really understanding some of the basics. And, you mentioned research, natural products research in the beginning. That's where the amount of research that's been done specifically in nutrients, we still have a ways to go with botanicals, but we're doing better. But the amount of research that's been done, compared to 20 years ago, in the last 10 and even 5 years, omega-3s, for example, I've spent over 20 years in the omega-3 industry, and we're up to over 50,000 studies have been done, published on omega-3s. I mean, that's just a tremendous body of work. And, I'm really proud of that we've really come so far as an industry to really, truly help, make a difference, because now we're at a point with omega-3s where the National Academies is finally looking at introducing a DRI, a daily recommended intake for omega-3s. And that's been in large part because of the tremendous amount of research that's been shown to prove that Americans have low levels of omega-3s in the blood. I actually published a study showing that 95% of kids in the US don't have adequate levels of omega-3s in their blood, and 2/3 of US adults don't, which is better than a lot of other countries in the world. So, we've really been challenged by omega-3 deficiency, but we're not getting it in our diet. So now we're working towards establishing this intake based on the breadth of research that shows how important it is. But that takes a long time. We're getting there.
It does, and we are getting there, and it's nice to see that. I was speaking with someone the other day, and I'm seeing a lot of younger people coming into the industry that are well schooled, and they've got this passion that we had when we started. And I mean, let's face it, some of us are getting old, so we need some new blood in the industry. So it's nice to see that they're actually attracted to the industry.
Mm-hmm.
So it's a good sign.
It is a good sign. And, again, I'll make myself sound nerdy for a bit. There's a favorite omega-3 or a favorite science conference that I go to every 2 years. It's called ISFAL, the International Society for Fatty Acids and Lipids. And it's truly some of the smartest people I know in the world. And they're really talking about everything from omega-3s, but also monounsaturated, coconut oil, avocado, all these things we love, even ketones, even cannabinoids now, because, they are in the land of fats as well. So there's some, and resolvents and protectants, all these things that people kind of know about. So even that conference has transformed over the years. And one of the companies I used to work for was DSM, and they sponsored a Young Investigators Award, which I loved. And I was always so happy to be a part of it. And so researchers and universities from all over the world would have their students be submitting these big project ideas. There'd be huge poster presentations and receptions, and really engaging with these students to get them excited and passionate about science. And then there was awards, and there was a big award dinner. And so the conference is coming up at the end of June in Quebec City. And I still go to the Young Investigator Dinner because I love sitting with these young folks who are eager and excited about, because I want to make them passionate about. We need to continue doing this research. And so it's so important that we mentor and really get these folks excited about it. So Women in Nutraceuticals does a really phenomenal job. I've done some work with them in recent years, but they do a similar mentorship thing where they're really trying to help engage young women in general, but also young female scientists specifically to enter the natural products arena.
It's every year when we go to Expo West, I've been blessed to be at every one that they've had since the very beginning. And I've seen that transform as well into something that was very interesting at the very beginning to where we are right now. And I'm always just amazed at how many new ideas are coming out, and how many new discoveries. But then I have to tongue in cheek on some of the new discoveries, because some of the new discoveries are based on things that are being used in other parts of the world for 1,000 years.
Right.
But it's new to us, I guess, here. So
it depends on the way you talk about it, right?
exactly.
And I think that's important too. And, we're always going to see, new delivery systems too. And again, Rick Scalzo was genius with Gaia, where he put the liquid extracts into a capsule, and it was the first, liquid herb extract in a capsule. And so, all these rip and tear powders that we have now, I mean, those are really new over the last 10 years. I actually have my own company now called Chomp Gums, which is a functional chewing gum company. So it's dietary supplement levels of doses in a chewing gum format. So you're chewing the gum, you have oral absorption, you make saliva, you also swallow the nutrients. And so that's a new form of a delivery system. So we're kind of always trying to find new ideas to kind of refresh, because, everyone has pill fatigue at the end of the day. So it's always good to, which is why I made the chewing gum. It was like, I can only take so many a day. And, at a certain point a day, I just need something else.
I love your gum.
Thanks.
I think it's wonderful, because first of all, when you start thinking, okay, this has got the good stuff in it, but it ain't going to taste good.
Mm-hmm.
But then you chew it and you're just like, wow, this actually is enjoyable. I'm doing something good and I'm chomping and enjoying it. It's fantastic. Yep. Great job on that.
Thank you. And you got to try, we have 2 new formulations coming out this summer. So you got to try one of the prototypes. We have a gum that's coming out with our first botanical extract in it. So you got to try the pomegranate extract. So it's a really nice organic water extracted pomegranate extract. So keep an eye out for that one.
Oh, definitely. I'll be making sure that I let people know when it breaks.
Yeah.
When I have my favorites, I have my spotlight companies. So what I do is I slide them in frequently. I want people to know, because people, they want opinions from the people that they've been listening to for a long time. So speaking kind of, you mentioned botanicals and herbs. And, when I first started in the industry, if herbs were ever talked about, they were only talked about in the light that they were a medicine and only used when needed and only used if needed. And here we are 4.5 decades later, and herbs, like other parts of the world, are part of our daily regimens. They're part of our nutritional foundation. That's been, a long transition, but it makes sense, but it didn't make sense to people way back then.
Well, even when I was in medical school, the way we were taught herbs, we actually took a full year of pharmacology first, and then we learned herbs by pharmacological drug class, which was a really interesting way to learn it. But we also had a medicine making class where we learned how to extract herbs and harvest herbs and walk through the forest and identify plants and things like that. So we kind of had both extremes of herbalism there, which was nice. And, make your own herbal teas and salves and things like that, which is how Rick and I became good friends early on, because he was in class teaching some of that stuff, which is how we met 26 years ago. So, but to learn it from the drug classes is also really important, again, from that drug herb interaction, because it's like, don't mix those two, because they're in the same family. Or if you're taking this drug, this herb might have some liver toxicity if used with certain medications. So it is important to really understand that, but that's where it gets complicated, right? Because guess what else is an herb? Basil, parsley, oregano, and those are food. At least in my garden right over here, I can see out my window, those are food. Those go into my everyday diet. And so, there are certain things that we can and should consume on a regular basis. We can talk about the Blue Zone diet for days, right? But, Rick and I have tried to break this down with looking deep into it. He's been to several of them. Rosemary is and rosmarinic acid specifically is one of the most important components of even the Mediterranean diet, but, specifically some of the Mediterranean cultures in the Blue Zone. So consume rosemary every day. There are certain things that are meant to be taken as medicine, like short term. And we actually talk about that when we talk about products and classes of products that are being sold. Like, these are the short term products. You only take them for a little window of time. Maybe if you're sick, or if you need to maybe correct something in your urinary tract system, or whatever it is, versus like these are daily maintenance products, and adaptogens are the perfect example of that. And that's something like even ashwagandha, if you look at the clinical studies of it, ashwagandha is not a short-term fix. Passion flower is. We can go back to talking about passion flower. If you need a quick like relaxant for the nervous system or acute anxiety, passion flower is amazing for that. But ashwagandha as an adaptogen is actually more effective at 30 and 60 days after taking it. So you have to take something like that every day to be able to see the compounded effects on the endocrine system, the different hormones in the body, to really see effective change. So, there's really different classes of herbs, and it comes with educating consumers and educating practitioners so that they're prescribing them correctly. So that, let's say someone comes in, they're in acute anxiety, they've had long-term stress, you need to address the short-term issues with some very fast-acting botanicals. Actually, kava is my favorite too for a situation like that. But then you really need to work on long-term, building vitality back and building resilience.
Where do you see the industry going in the next 10 years? I keep asking myself this almost every decade, and I've been completely wrong every time. But I have always said that it's going to keep moving. It's going to keep being more transparent, and those have come true. But where do you see, because I think we're very ill as a nation. We have sick care, not health care. We're in a situation where we have let processed foods run our lives. The food companies have learned how to make really unhealthy, terrible things taste really, really good. And do we crave them? Yeah, we absolutely do. But where do you see us going? Like a personal idea.
Yeah. I'm not going to get political, but I've spent a third of my life in DC, so I'm going to get a little political.
That's fine.
We're at a crossroads right now. There's a lot of directions that a lot of things can go. If this tariff thing goes down the way it's kind of played out, but then backtracked, but then maybe played out, some countries, the tariff thing is a scary thing for the industry. So that alone can really be a disruptor because it's going to increase cost of products substantially. So my fear is that it limits even basic nutrition staples. Like I'll take prenatals, for example. Like in my opinion, and this is some of the work that I've done in public health nutrition research, is helping the government understand how vulnerable populations are with, pregnant women of lower socioeconomic status, WIC, and also SNAP, which is the food stamps. They should be able to get a prenatal vitamin if they're pregnant.
Agreed.
Like that should just be basic healthcare. That should actually be a prescription. That's a no-brainer, but we don't even do basic things like that. And so when things become less cost affordable for consumers, stuff like that really falls off the table. And, vitamin D is another one too. Calcium and vitamin D. I've done, economic analyses on the impact of taking or not taking vitamin D and calcium for osteoporosis. 95% of Americans don't get enough vitamin D from their food alone. But what are we doing about it? Are we going to make it easier or harder? Are we going to be able to provide more opportunity for people to take it? There's a lot more opportunity for just understanding some really basic and simple things to really help people just be healthier. But like I said, I'm excited to see more practitioners. I know, sometimes, early on, like a lot of folks in the naturopathic field were like, we don't want all practitioners to know this. Well, I do. From a sheer public health perspective, I would rather have healthy people around me. And so I've always joked, I give more free information than I have paid, because I'm more than happy to help someone figure out which fish oil is the best fish oil, or omega-3 if you're a vegetarian, which algae, I want people to know this because we're a sick nation and we have some really sick stuff going on. And so, it's not just the tariffs, but we do have, opportunity with this administration for as many alarming things. There is some good that can potentially come out of some of the awareness that's going on around, the importance of taking food additives and food dyes and, artificial sweeteners and, all those things. I mean, there's a lot of work to be done. We could have a whole other show on that. And, some of the work that's, I've contributed to with public school lunch programs and things over the years, and taking soda out of vending machines was a big initiative that I was working on, 15, 18 years ago. So, we can make change, but unfortunately, none of it happens quickly. So I think it's important to prioritize, like, what are the things that really matter? I always, say to folks, what's the low hanging fruit? What can you change quickly? Versus what do you know that can take time? Because I've been around a long time, it's easier for me to identify the ones that are just going to be slower. And so it's also managing people's expectations.
And to that point, which is beautifully stated, I think that the low-hanging fruit is a way of not only making small success stories along the way, but it also is very, very motivating and keeps you in the race for the long-term ones.
Yep.
And but if you're only striving for the long-term ones, God bless you, you're reaching for the stars. But it's kind of lonely just standing there waiting for the star to come in range when you could be doing things along the way and supporting your ideas and your focus.
You said it perfectly. And I've always used that core motivation, like, especially even with my patients, like, okay, you've got a lot going on. What can we change so that you feel better tomorrow and next week versus 3 months from now? Because I want you to stay motivated to make the long-term changes so that you can be on a forever track. Like I've always said, what's the difference between diet and diet, right? Like the word diet versus being on a diet, like, you should be on a diet your whole life. Like a diet isn't something you do in the short term and then return to a crappy diet. Like your diet should be the foundation of you're just trying to make it healthy. It's not a healthy diet and then I go back to a bad one. There's no going back to the bad one, people. Like,
no.
Yeah.
And I think we have to remember that we are a very, very, and I was speaking to Rick about this, very impatient world. He used to talk about at Gaia how, he used to do with his formulations, he used to do front loading. And back then, he was doing it for, because he wanted people to feel a little faster and see faster, more successful results. But today he's doing the same thing. But now we're in a very, very impatient world where people have a tendency, if they don't see results by Friday, then everything's wrong with everything in the industry, nothing works, and I'm not going to do it. But these are the same people that will not go into a really great quality health food store and have a conversation and ask about something.
Yeah, and that's actually one of the things. We're losing a lot of independent health food stores where folks could go in and ask those questions and have the people on the floor to answer that. I actually, when I lived in the DC area for 13 years, and I worked, my clinical practice was in Bethesda, across the street from the National Institutes of Health at a pharmacy called Village Green Apothecary. And they have...
I know that place.
Yeah, a lot of people do. A lot of people in the industry have kind of gone through there. And so they did a great job with creating a clinic space for practitioners like myself, where we kind of had part-time practice. But inside, they did an amazing job with having several people on the floor in there to answer questions. And like I would even say, tell so-and-so that I sent you in there, like Brian specifically. If I was like, just tell him Dr. Keri sent you, and he knows the brands I like, he knows the products I trust, and he will tell you exactly what. And so it's just really nice to see places like that, but places like that are disappearing, which is why education, and not education from influencers necessarily, because the number of influencers I've had to subtly be like, I know you think you know what you're talking about, but that's not quite right. And I say it kind of like DM them, not publicly. Some of them take it really well and are super happy to learn about it. Some of them get really offended. But, that's one of the hard things for me right now, is to see influencers who are just completely untrained spouting about all kinds of crazy stuff. So they're the ones confusing the messaging.
I give them credit for getting the word out and creating a little bit of low-level interest.
Yes.
But to your point, I've had to have some little private DM moments myself. And I'm like, look, thank you for what you're doing. Yeah. But here's some things that you might, and most of them will come back and they'll say, oh my goodness, thank you. Yeah. I want to make sure I'm doing this right. Or who are you and why are you talking to me? And I'm just like, okay, we're not going there.
Yeah. And like you said, to their credit, some of them truly are invested in learning because they're doing it for themselves too. And they want to be healthy. I mean, that's actually, I would say, here we are, right? What is the biggest change in the natural products movement? Influencers. Because now suddenly they're on TikTok, on Instagram, on all these, social sites. There's a massive amount of people talking about nutrition and wellness and being healthy. And that's really, truly the first time we've seen that trend. And even with exercise, like there's a whole new revolution of, younger people going to the gym and hitting the weights and just trying to be super fit. I was joking with someone not that long ago. I was like, who knew? Apparently big butts are in, like working out and, leg day and glute day, it's a thing now,
A big thing, no pun intended.
A really big thing, yeah. I was like, after 50 some years, I'm finally winning.
I love that. Okay, now I just lost my train. I love what you're saying about the industry and it is incredible what you've been able to do in the years that you've been in the industry. You've brought so much good information and you've been able to really, really make changes. Where do you see yourself in 5 years?
Great question. So, I'd mentioned, this company that I recently founded and I'm the co-owner and CEO of Chomp Gums. And I'm also consulting for a couple of different companies, including Kokora. And well, for one, I don't see myself stop working. So let me just be clear. Like, again, without saying my age outright, like I don't ever see myself not doing something, some kind of consulting, however many years down the road. I have my 5-year vision for my gum company, for Chomp Gums. So that's where like I really see myself in the next 5 years developing that. But I'm also working on some other side projects and clinical research that I'm super excited about, that I can't really give that much information about now, but that research that we're doing and planning for right now, and some of it's in the medical food space too, is to me really transformational because we're getting older. Me and you, Jeff, we're getting older. And so some of this stuff is like regarding healthy aging and, being cognitively intact. And so I love having my hands on the pulse of research. And so that's, again, I think I just see myself doing more of the same in 5 years, still young enough that, but really, I think just seeing my gum business, grow the way I'd like to see it grow and with some of the opportunity that we have with it. So we'll see.
I was talking to a friend of mine and she's 97 years old and one of the brightest people I've ever met in my life. Very intuitive, still reads like crazy, still walks every day. And drives, believe it or not. Amazing. She's been a vegetarian for like 70 years. She's very healthy. And I said to her, sometimes it's frustrating. And she says, what's frustrating? I said that, you could be doing so many things today that I may not even be here to see the results. And she says, okay. She goes, what is the best time to plant a tree? And I said, today. She goes, even though you may not ever see the shade of that tree and sit underneath it, you're doing something for somebody down the road that may put a swing in that tree or have a picnic underneath it. And I went, okay, I get it.
It takes 10 years for an avocado to grow when you grow it from seeds. So you better plant that avocado tree soon.
So we're at the point now where I love to ask my guest for a thought of the day. So let's have a Dr. Keri Marshall thought of the day.
So I drove back from DC yesterday. I was up there we donated, we were giving, actually my friend donated that I grew up with to my college rowing coach. And I had a great weekend with my college rowing team and doing this boat dedication from my former coach. And I listened to a podcast on the way there, and it was so interesting that I re-listened to it, and it was 3.5 hours. So that's saying something for me, right? I don't normally have an attention span for things like that, but it was on relationships and being in relationship with yourself and others. And I was like, there's a lot to learn here. It was Huberman Labs and Lori Gottlieb. And one of the things, there's so many things in there, but one of the things that she talked about was the opposite of depression being vitality. And, it's this whole thing where when you're dying, there's a whole part of it where they talked about dying. And, depending on how you lived your life really is like, are you going to be the person when you're dying that looks back and has all these regrets because you never did all the things that you said you were going to do? Or are you going to be, that person who's like, wow, I've lived this rich, full life. I've checked so many boxes of things I wanted to do. And so, it's just this really important concept of vitality and really living. And I've had many important people in my life and friends pass away in recent years and far too young, and some battling cancer now. And, it's really just weighed heavy on me in terms of this concept of how do you live your life the best you can. And, I just talked about, I'm a total workaholic, but at the same time, I go to extreme levels to find that balance and enjoying myself and surrounding myself with people I enjoy being around and taking the trip, not saying, God, do I have the money? Like, you don't know how much time you have. So, book that ticket, take that trip, do the things that scare you, go outside your comfort zone. So that's I
love that.
Yeah.
That's beautiful. Thank you. And good information. Before I sign off here, will you come back and see us again?
Love it.
I'd love to have you back again. I think you are such an absolutely incredible addition to this industry. I think the work that you have done, the work that you're doing, and I can only imagine what you're going to do moving forward, how it's going to help to change the industry. I thank you so much for being here.
Thanks, Jeff. We're definitely doing it again.
Wonderful. Thank you, everybody, for tuning in today, the Honest Health Podcast. Remember, you can always go to the YouTube channel and watch these. Make sure to, per my producer, like, subscribe, and say yes. So it's new for me. So thank you, everybody, for being here today. Have a wonderful day, everybody. Thanks for tuning in. God bless.
Stay tuned for more information from the Honest Health Podcast with Jeffrey Burke. And make sure to check back often for interviews and conversations from the guests we all want to hear from. I'm John the Announcer. Thanks for listening.